Good afternoon, everyone. I'm Bert Eichel, Health Officer of Mobile County. It is October the 4th, 2021. We're excited that COVID community transmission rates continue to decline in Mobile County, Alabama. At this point in time, we actually have 85 persons in the hospital with COVID in Mobile County. Unfortunately, two persons died in the past 24 hours from COVID. So, as we continue on with a decline in the COVID community transmission rates, thank you everyone for wearing a mask, getting vaccinated, and socially distancing. We still have a ways to go because we do not have enough persons in the state of Alabama or in Mobile County who have been fully vaccinated. There's some questions coming out about Merck's new drug that has been introduced on the market as an experimental drug. The FDA is looking at this particular antiviral drug as a treatment modality for COVID 19. As an experimental drug, it may be available to you, but it's very expensive and it doesn't appear at this time to have any more beneficial effects than the monoclonal antibodies, which are free. So if you test positive for COVID 19 and in a high risk group as outlined or defined by the CDC, you're eligible for the COVID 19 monoclonal antibody treatment to limit the dissemination of the disease. This is especially important with the older population or people who have underlying medical conditions. So, thank you everyone for your hard work. Thank you for taking COVID 19 seriously. It is not over. We thank the superintendents of public schools for masking the students. Until we get a community transmission rate down to less than 5%, which it is doing, is heading in that direction. It's probably a couple of more weeks before we get to the 5% community transmission rate. We highly encourage people to continue to wear masks when you're around people who you do not know their immune status, or when the children are going to school, or when you're having any type of social gathering. But it's going in the right direction. We will survive COVID 19, but it's not over. Will it ever be over? We think so. We think it will get down to where there's no community spread, kind of like the control of forest fires. Occasionally there'll be a hot ember or there'll be a source of ignition for more community transmission, but we think it will be significantly limited because people will be fully vaccinated and will limit the ability for people to go to the hospital and die from COVID 19. The end result is we don't want loss of life. So, yes, we can have people get infected with COVID 19 just like we have people get infected with strep throat. What we want to do, our goal in this pandemic, is to limit the loss of life, and that's through preventive health measures and people getting vaccinated. There's no perfect solution to this disease, but there's a way to limit it from taking another human life. So, for those of you who have lost a family member or a loved one, God bless you. It has been terrible. For those who are still thinking about whether they should be vaccinated, please do so. It's very important. We have lost a large number of people. In Mobile County, we've lost over 1,100 people, and 1,000 of those, 1,000 of them, were not fully vaccinated. So, again, thank you, everyone. Loss of life can be prevented, but only if you will take vaccination seriously and talk to your doctor if you have individual concerns, and let your physician help you make a personal decision. Please do not rely on social media as being an authoritative source. Thank you, everyone, and stay safe.